Now I'm going to do an alcohol ablation while the PRP and the PRS are being prepared. So I'm using the linear probe. So this is the shaft of the femur, and now I'm going to inject alcohol into the supralateral genicular nerve, spinal needle. You can see the dark one is the outline of the femur. Now you can see the color Doppler, and I'm going to introduce the spinal needle. You can see the red arterial pulsation there. This is the site of the nerve. Still it will drop on Still it now. I am going to inject 1 ml of saline. Adhe kamchi. Saline. And you will see the hydro distension. Increase ಆರ್ದಾದೆ. Okay. Now 2 ml. Now we are injecting alcohol. Now I am going to inject the indentation where the epicondyle is taking off, and color Doppler is switch on. This is the spinal needle. You can see the this one, okay? Yeah. See that?
Yeah, yes, sir.
The line. I'm doing the hydro dissection. Wait.
They know your control.
Alcohol, sir.
2 cc. Aspirate.
See the distension? That's the alcohol being injected into the periosteal space. Finish. Supralateral and supromedial.
Medial.
And now I'm going to inject the infromedial. Okay? Color Doppler cancel. Good. Now I'm going to inject the infromedial nerve. You can see the outline of the tibia, and this is where it is taking off. Now hydro dissection with saline, inject. Okay, fine. Nerves injected. Now I am going to inject the intermediate genicular nerve. This is the outline of the femur you are seeing there. And now I am going to introduce the spinal needle from lateral. You can see the spinal needle on the anterior cortex of the femur. 1 ml. You will see the hydro distension of the femur there. Intermediate genicular nerve. Okay, 2 ml of alcohol. Yeah, okay, now you can see the distension over there. Finished. Alcohol ablation has been done.